We are constantly being told to wear face masks, and now we have been wearing face masks on and off for so long, if you don't have a mask and you walk past someone with a mask, they look at you with daggers, living in fear thinking, where's your bloody mask? And now with high school students wearing face masks in class, what does the science say? Everywhere we go we see no masks, no entry, or face mask, face coverings must be worn. Now, when we heard infectious diseases specialist Dr. Tony Fauci speak on face masks, he was talking about the science of face masks. Now, I mean by the science of face masks is mask wearing for the reduction of contracting a respiratory illness that is airborne via droplets. Let's take a listen to what Dr. Fauci had to say a couple of years ago, just on the general well-being about reducing your risk of infection. Here he speaks with Bloomberg.
And the best way for me to prevent getting an infectious disease and having to have you as my doctor is what? Wearing a mask?
No.
Don't need to do that. If I can see they're ready to sneeze or cough, walk away.
You avoid all the paranoid aspects and do something positive. A, good diet. B, you don't smoke, I know. I know you don't drink, at least not very much, so that's pretty good. Get some exercise. I know that you don't get as much exercise as you should.
That's correct.
Get good sleep. I think that the normal, low-tech, healthy things are the best thing that you can do, David, is stay healthy.
All right, well, I'm going to try to do that, and hopefully when I next see you, I will be even healthier than I am today.
I would imagine you would be, and I look forward to that.
Thank you very much.
Now, here we have Dr. Fauci and an interview with 60 Minutes. In this interview, he goes on to say that masks should be worn by people who are sick with the virus and to reduce the risk of spreading it via droplets, sneezing, coughing, splattering. And for everybody else, there's no need to wear a mask. It only is a psychological benefit, thinking you're protecting yourself better. You may even stop a droplet. He says masks are inadequate. Now, Dr. Fauci's recommendations were based on science, nothing more. Now, that 60 Minutes interview with Dr. Fauci was early in the COVID pandemic, and then it was later on fact-checked by Reuters. The fact-check went on to say that it does not represent Dr. Fauci's current stance on face coverings, nor the updated guidance issued by the Centers for Disease Control and Prevention, also known as the CDC. The fact-check verdict: partly false. Video shows Fauci's remarks at early stages of the COVID-19 pandemic, when masks were not yet recommended by the government. That's not science. As the publishing of this check, Fauci recommends the use of face masks. So why did Dr. Fauci change his view on wearing face masks during a pandemic? Was his views based on science, or was it influenced by the government on making everyone wear face masks for other reasons? So what does the science say around face masks? This study was taken from the British Medical Journal, a prestige medical journal. It was done in 2015, so no bias and no conflicts of interest, as it was done in 2015 pre-COVID pandemic. Now, this face mask study was done on cloth masks compared with medical masks. Now, the aim of the study was to compare the efficacy of cloth masks to medical masks in hospital healthcare workers. The null hypothesis is that there is no difference between medical masks and cloth masks. Now, staff wore the mask on every shift for 4 consecutive weeks. Now, those with medical masks, they were supplied with 2 masks daily for each 8-hour shift, while participants in the cloth masks were provided with 5 masks in total for the study duration, which they were asked to wash and rotate over the study period. They were asked to wash the cloth masks with soap and water every day after finishing the shifts. Participants were supplied with written instructions on how to clean their cloth masks. Masks used in the study were locally manufactured medical masks, which were a 3-layer made of non-woven material, or cloth masks, which were 2-layer made of cotton, which were commonly used in Vietnamese hospitals. The control groups were asked to continue their normal practices, which they may or may not have included mask wearing. Now, mask wearing was measured and documented for all participants, including the control arm. Now, everyone in the study used the masks on every shift for 4 consecutive weeks. The main outcome measures were clinical respiratory illness, or influenza-like illness, and laboratory-confirmed respiratory virus infections. What were the results of the study? Now, the rate of all infection outcomes were highest in the cloth mask arm, with the rate of influenza-like illness statistically significantly higher in the cloth mask arm. Cloth masks also had significantly higher rates of influenza-like illness compared with the control arm, and the control group being those who may or may not have worn masks. Now, penetration of cloth masks by particles was almost 97% and medical masks 44%. They concluded this study is the first random controlled trial of cloth masks, and the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks and poor filtration may result in increased risk of infection. Further research is needed to inform the widespread use of cloth masks globally. However, as a precautionary measure, cloth masks should not be recommended for healthcare workers, particularly in high-risk situations, and guidelines need to be updated. Here we see Dr. Anthony Fauci wearing a cloth mask, and in Australia, the Victorian Premier wearing no mask. Now, we have seen many different types of masks being worn out in the community: police officers, civilians, government officials, some breaking the rules like this officer here, Senior Constable of New South Wales Police. Here we have the police here in various different types of masks, the army personnel. We can see here the army have surgical gloves on here. Some police here have no gloves, and the other has his motorbike gloves or some other leather gloves. So the issue here is they'll be taking their masks off, not washing their hands, not disposing properly of the masks, touching their face, eating, interacting with each other, increasing the risk of cross-infection. And millions of people get around like this without getting infected. So there is a lot of half-truths out there and misconceptions, and what is being told and what is actually being forced on the people is not necessarily based on pure, honest science.